Hello, everyone. I'm Pamela Marshall at the Wellness Radio TV and at the Wellness Radio TV podcast. Welcome to this edition of Sisters of Wellness. So, our goal is to work with you, our many friends from around the globe, to offer information and advice that will help you live a whole, powerful, strong, harmonious life. I hope you are safe and well wherever you are tonight. We are not just talking about COVID, but talking about how COVID is impacting those that call the streets and shelters home. Throughout the U.S., of course, we see the statistics about the COVID cases rising, and it is said that those who are homeless are 3 times as likely to die as a result of complications associated with this virus. Our guest tonight is Abigail Perret-Gentil. She is with a very important organization here in the Gainesville, Alachua County area, Grace Marketplace. It is a place where they shelter the homeless. But Abigail has also started an organization called Grace Grows. She is the founder of Grace Grows. And Abigail is here tonight to tell us to be a voice. We are seeing everything about frontline workers. They're critical. Prominent people who are getting it, they're important. Family members and friends and coworkers that we've heard about who have contracted this virus. But who's telling us about the homeless population? So Abigail, thank you very much for the work that you're doing, and thank you for being our guest tonight.
You're welcome.
So what are you seeing? You know, when let's go back to March, when we first really started the widespread shutdown of COVID. What were you seeing with the homeless population?
So at the beginning of the pandemic, it was really scary because we knew that the people that we work with are so incredibly vulnerable. And, people are typically looking at people who are older as a vulnerable category. But people who are experiencing homelessness experience so many health disparities that, particularly where I'm working, being a low barrier shelter where a lot of people have experienced long-term homelessness. Um, we have people who have tuberculosis, people who are elderly, people who are HIV positive and have hepatitis. And so a lot of immune compromised people combined with a lack of access to hygiene and working with people who were
Abigail, we just had one of our guests say that they're hearing an echo. So when you're speaking, can you turn my volume down? Can you turn the volume down there?
Yes. I have it on high. Is that better?
Yeah, that's better.
Okay.
Miss Flora, Dr. Flora Kate Claybrook in Humboldt, Tennessee, thank you for letting me know that and tell me if that's better. We appreciate all of you who are watching. You have an opportunity to ask questions, perhaps to find out what's going on in the communities where you live and how you can help. So, Abigail, continue.
So we are working with people in an encampment, and we're working with people who are sheltered here, which is a congregate facility. Our dorms have a bunch of bunk beds all lined up near each other. And so it's just as risky as being in a nursing home, except for the fact that people who receive services here are experiencing crisis, mental health issues. We have people here who are getting treatment for cancer. And so all of these factors combined just make it such a high risk for the people that we work with. And it's also that they don't have access to media like most people do. And so I was running around this encampment trying to talk to people about COVID, trying to explain what it was and to tell people what was going on. And, that takes days. and all across the country, the response for COVID, for people experiencing homelessness, was really delayed because there wasn't an infrastructure in place to address that for this population.
How has that changed?
So we've adjusted, and I think that it could still improve. But the problem is that, this is something that's brand new. We could compare it to other things that happen in shelters. There are outbreaks in shelters of other pathogens that aren't as common in the regular population. And so we could model it after, certain types of outbreaks like tuberculosis or hepatitis A. But we really didn't have a system in place, and we were very much on our own because the whole country was in chaos. And so, we reached out to our health department, and I talked to people in King County, Washington, who had this very comprehensive response to addressing it for homeless people in their community. And they had way more resources than we did. And so, talking to the health department and some of the aid doctors that work with us, we would have liked to implement something like that here, but there just weren't the resources. And so, pretty much this whole time, we've had one doctor with the Medical Reserve Corps, a man who's in the vulnerable age category here, testing people. We also did a collaboration with the University of Florida at first. They were with the Emerging Pathogens Institute, because they were going around testing people to see how COVID was spreading. And because we couldn't get resources locally, that was the only way that we could get people here tested at first. And so we've been doing monthly community-wide testing, where it's a big event and we incentivize it so that people come. And at first it was really hard to get people to come because people didn't understand what COVID was. There's a lot of mistrust in the homeless community, which is understandable in my opinion. So it takes a lot of communication and conversations. But over time, as we've done this, people have really gotten on board. And I serve coffee and donuts when we do the community-wide testing, and I set it up out in the open in a field so that everybody can see all the people coming. And I spend my time serving coffee and donuts, and the doctor and volunteers will test people for several hours. And our goal is usually to test about 50% of the people that are sheltered. And we usually do more just to give us a picture in time of what's going on to make sure that we don't have an outbreak. But anybody who comes here to receive shelter gets tested, goes into a quarantine area, and then when their results come back, they're able to go into the main dorm. Most of the positives that we have gotten are people who were in quarantine, so they never went into the main dorms, and they were separate from everybody else, so we haven't had community spread. And also, surprisingly, a lot of the people who've tested positive are people who've come out of the jail. And it's very statistically significant, which tells me that people are leaving the jail with COVID.
They're leaving the jail with COVID. You're going to have to turn the audio down. I think I can hear it again. They're leaving the jails with COVID. And there's nothing that's protecting their relatives or other people they come in contact with once they leave the jail.
Yeah. So the other thing is that the health department doesn't know how to do contact tracing with people who are experiencing homelessness. So we've had to implement our own contact tracing program because we know the people and we know how to communicate and how to find people. But when somebody doesn't have a phone or an email, how are you going to call them? How are you going to ask them questions about who they've been in contact with? When somebody's experiencing crisis, even if they do have a phone, that's a challenge.
So, Abigail, my guest tonight, you have to turn it down, Abigail. My guest tonight is Abigail Purette Gentile. She is a community outreach person with a homeless facility here in Gainesville, Grace Marketplace, as well as the founder for Grace Grows. I understand that there's been some post on social media that if COVID is that bad, why has it not killed more homeless people, which I think is a um, very insensitive thing. People post all kinds of things. And I find that to be very insensitive, considering all the challenges that people have. Um, have you seen or been aware of those kind of posts?
Yes, and outside of COVID, I see some of the most like cruel things that people can say about human beings. It sometimes it's like people, when somebody's homeless, they don't talk about them or treat them like they're an actual human being. Um, and um, when I do community engagement, I try to diplomatically address some of those things. People are a lot nicer in person, but I know that it's not super uncommon.
So
Um,
we have this crisis within a crisis. We have people who are homeless. That's a crisis. We have people who are homeless who have mental illnesses. That's a crisis. We have people that are homeless who have mental illness and substance abuse. That's a crisis. Then you put a pandemic on top of that. How is that um, stressing the resources that you all have for helping the homeless population?
so the resources in that sector aren't great to begin with. Um, and, you know, one of the things that I try to explain to people is that the people at the shelter here on the ground working are like aid workers. Um, and, you know, at the beginning of the pandemic, everybody was talking about all the first responders and how heroic they are. And the people that I work with very much are first responders. Um, and so it's scary because I know from being around here for years that every year I see people die from the regular flu and from getting pneumonia. And my thoughts at the beginning were, if I see this many people die this often just from the flu, what is going to happen if COVID comes here? And
Mm,
here at the shelter, we've been very successful in preventing community spread, but that doesn't mean that it can't happen. And if it happens, it can happen rapidly. There's shelters across the country where they went from one person being positive to 76 people in a matter of days.
wow.
And one of the things that we did at the beginning is that we requested funding from the city and the county to put the most vulnerable people in in a hotel so that they wouldn't be in a congregate facility. And we requested funding for about 60 people, and we had a doctor determine their medical vulnerability. This wasn't something that we just arbitrarily decided. And we got funding for about 20 people, and then we housed them all from the shelter or from the hotel rather than having them come back to shelter. But there were many more people, and now we're at capacity at our shelter, and we have new people, and we don't have a hotel for those new people who've come in that are medically vulnerable as well.
Abigail, with what we're seeing with people losing their jobs, how have you seen, or how has that impacted the number of people who need to be sheltered?
So, more recently, um, there's been newer faces. I remember a couple months ago, there was one day when we were doing intakes that it was all people that I hadn't seen before. And that, that kind of scared me because I was thinking about the wave of homelessness that could happen due to the economic crisis that we're now experiencing, and what's going on with the eviction moratorium after the moratorium ends. People have all this back pay that they have to pay, and they're going to be evicted immediately, which can create this massive crisis for homeless services all across the country. And what do you do about housing twice as many people during a pandemic when you're not supposed to be crowding each other, when you're supposed to remain 6 feet apart in facilities that have dormitory living? It,
Do you feel Abigail is with Grace Grace Marketplace here in Gainesville, Alachua County? It is a place where they service the needs of the homeless population. As you watch the news, because I haven't seen any stories on COVID and the homeless population. As you said, we oftentimes treat homeless people like they are not human. I think the insensitivity to how we treat homeless people is criminal in this country, to be quite frank. We, because there are people who do have substance abuse problems and people who do have um, mental health issues, that's all the more reason why we should be doing more. But it seems that we're doing less. For you, how do you keep going, Abigail, in doing the work that you're doing? Not only do you do the work there, but then you started another organization, Grace Grows. What's inspiring you to do this work?
well, one of the things that keeps me from feeling demoralized is that I I get to help. Um, and at the beginning of the pandemic, so many people were so panicked, and everybody felt so powerless. And I just felt lucky to be able to come here and do something to be able to help. As ineffective as resources can be, um, I felt lucky to be in that type of position, rather than sitting at home and reading the news and feeling powerless. Um, one of the things that So when people ask me what motivates me, there's the really sad thing that I can say, and there's like the happy thing that I can say. And every day, to avoid compassion fatigue, I tell myself one terrible thing, and then to keep myself going, I tell myself one wonderful thing that's happened. And generally, the wonderful thing is seeing people succeed, seeing people, somebody who's been living on the streets for 60 years, housed. Um, and the terrible thing are the things that you don't hear about in the news. They're the things that you witness in your interactions with people, the things that when you see somebody die who was 2 days from being housed, Or I had a woman yesterday, an elderly woman in a wheelchair that didn't have access to supplies for medical supplies that she needed, and she had a colostomy bag. And so instead, she had taken a trash bag and taped it over it because she didn't have the medical care that she needed. And that should never happen. She's a sweet older woman. She deserves dignity, and she deserves safety and health. And sometimes when I look at um, you know, the fact that, you know, 40% of people experiencing homelessness have a disability compared to about 14% of our population. And I look at how it's not their fault. And even if it were their fault, they still deserve, basic human decency and safety. Uh, and when I look at that, you know, it motivates me because it's so wrong. And I don't think that the majority of our society is privy to what's happening. And and I like to believe that if people knew, they would do something. But it's just not a priority when it comes to what we talk about in our media.
And 50% of people experiencing homelessness have experienced traumatic brain injuries as
Yeah, so
well.
one study showed that 50% of people have experienced traumatic brain injury. And, anecdotally, I can say that many of the people that I've worked with have experienced traumatic brain injury. And that can be um, caused by many different things. Sometimes it happens after somebody becomes homeless. People who are experiencing homelessness um, are subject to a lot more violence than the average population, particularly women. But then we also have a large homeless veteran population, and they experience traumatic brain injury um, when they were enlisted. So there's many different factors at play, but I think that statistic is important because um, when you work um, in this field, you just start to notice um, these these trends,
Mhm.
and these trends just point to all these disparities that exist. Um, so many of the people um, that are here have schizophrenia, and schizophrenia is incredibly rare. I think the statistic is like 0.1% of the population, but I know so many people who have schizophrenia. And so that tells you what the outlook for people is, and that tells you that we don't have services to help those people. And so many times, shelter environments are and homelessness in general is the result of not having these systems in place to help people who need it.
And as I watch sporting events, as I watch other activities in our society, and I just think, how do we forget? How do we, as a God-fearing Christian society, completely drive past places where you see homeless people as if they're invisible, as if because they are homeless and whatever it is that caused them to be homeless, it's not my responsibility to do anything. And now we have this pandemic that's causing a challenge for everybody. It's said that 40%, or maybe more than that, of the US population, it's higher than that, it's 400, cannot stand a $400 emergency. And now we have people who've lost jobs. So if people are living paycheck to paycheck, I saw another story with a long line of cars, of people picking up food. And my husband called me to the television because he wanted me to see it. And I said, but those are people with cars.
Mm-hmm.
Think
Yeah.
about the population who need help, who do not have cars to go get in line to get food, nor do they have any place to cook it.
Yeah. I don't think people realize the snowball effect. I give a lot of talks to students at the university, and one thing that I try to explain to them is that your car breaks down and you're going to have a bad day. Um, Somebody who's experiencing a lot of poverty or on the verge of homelessness, their car breaks down and their life as they know it is over. And it just becomes this snowball effect. The longer that somebody is homeless, the longer they're going to be homeless. And that's what we try to do here with our housing first approach is we try to get people back into housing as quickly as possible and then address some of the other underlying issues that put them at risk. But we really need more than that. We need our whole community because being housed doesn't end poverty.
Mm. Being housed does not end poverty, which means we can get them someplace to put their head on the pillow at night. But there are other things that they need. Tell our audience what you're talking about the other services needed.
So we need mental health services badly. Um, we need community services so that people who have been experiencing homelessness, and particularly long-term homelessness, can feel part of the community again. It's incredibly alienating uh, to be homeless, and sometimes it's hard to be behind four walls if you haven't been behind four walls for a long time. And in our permanent supportive housing program, for people that are the most vulnerable, we have case managers that will visit them about once a week, sometimes more. But it's not enough to just have a case manager visit you. Sometimes you need medicine, you need nutrition. Um, Many of the people that I work with, when they get housed, they become more food insecure because they have to choose between paying a bill and buying food. And so we need services for people to increase food accessibility and food sovereignty in communities that are experiencing widespread poverty and food deserts. Many of the people that I've worked with in the garden and come from a community locally that is a food desert, and they go back to that community and talk about being hungry. Like, how hard is it to function if you don't have enough food? And these people are now expected to be 100% okay. They're expected to have jobs. They're expected to run around town and receive mental health services or put their lives completely back together. But it doesn't work that way.
Right, just because you put a roof over their heads. I also want to look at, when we were talking about COVID and how the homeless population is being impacted by this pandemic, it is estimated that 1 in 500 African Americans will die of COVID by the time this pandemic is over, which is alarming. And then we factor in the large percentage of African Americans. 40% of African Americans are homeless. 40% of the homeless population are African
Yeah.
Americans. And African Americans make up 13% of the US population, but are 40% of the homeless.
Yeah, it's unbelievable. It's just such a huge disparity. And it's not just that, it's that when an African American person is experiencing homelessness, they're less likely to receive housing than a white person. Um, and so 32% less likely to score on, um, so there's this assessment that is used all across the country to rate somebody's vulnerability. And the higher you score on that assessment, the more services you qualify for. And they're 32% less likely to receive the score that they need, even though often African American people actually are more vulnerable because of the circumstances that they come from. And so it's not just that more are becoming homeless, more are staying homeless.
So what's in the assessment that's caused them to not meet that score?
So I can only tell you my theories and my thoughts. I think that it has a lot to do with bias, who's performing those assessments.
That makes me sick. That really just really grates my whatever. And that's horrible. I mean, it's as if it doesn't matter what happens.
I also think that these types of assessments are also created with bias in the first place. Um, and so not only is there bias in performing it, but I think that they're created with bias, and they're not created with a lens of um, of equity um, and historically there's many different assessment tools that we still use today that are super popular, um, that were created with bias, and they're not accurate, like our IQ tests. Those aren't those aren't accurate.
So we have a population, a larger percentage of African Americans that are homeless than other groups, and then they are chronically homeless and are likely to remain homeless, is what you're saying.
Yeah.
What is it that who's advocating? Anybody? Homeless people can't hire lobbyists, and if you're saying your shelter and shelters across the country have limited resources, who's advocating on behalf of the homeless population?
So it depends on where you live. Sometimes there's activist groups that do, but it's not really a large number of people. Um, People that work at shelters, that's not a large number of people. Um, there are, larger organizations like the National Alliance to End Homelessness. Locally, we have the Continuum of Care, the Alliance for the Homeless and Hungry locally, which gets together all the service providers so that we can coordinate and work together and more efficiently. Um, but that's not a big part of our population, and um, like you said, um, eh, there aren't really a lot of people to advocate for people who are experiencing homelessness because it's alienating, and they generally don't have resources. If they had family members to take them in, they wouldn't be here.
As you're talking, and based on where Grace Marketplace is located, on the way to the airport here in Gainesville, you can see a lot of homeless people because you are located near there. And I just think about people who go to the airport to get on the plane under normal circumstances when we were flying, to fly to other parts of the world, to fly to other countries to help. And we pass people on the way to the airport that the cost of your plane ticket could do so much for the
It could
people.
house someone
The cost of
permanently.
your plane ticket. And so while I applaud those efforts, but scripturally it says charity starts at home and then spreads abroad. So until everybody in your community, their homeless needs have been addressed, I don't think we need to be calling Delta or American Airlines for anything. You do not have to go that far to help
Thank you.
somebody. I'm just saying. You have started something that is very, very near and dear to me, a farm girl that I am. Grace Grows. You all at Grace Marketplace have a community garden, and you have helped people grow their own food. And then you
Yep.
started Grace Grows. Tell everybody what Grace Grows is.
So Grace Grows started as a really small garden, um, and we eventually scaled it up as we knew that it was manageable and sustainable because we really didn't want to detract from the resources of the shelter here. And a lot of times, well meaning people will start projects, but they end up detracting from resources that are really needed. And so we have a garden where people can reserve their own bed,
Hmm.
and I always have seeds on me, and these are the old varieties of seeds as well. So the stuff that people grew up eating that aren't as common in the big box stores. Um, and people can request seeds at any time, and they can reserve their own bed, and they have complete autonomy over their garden. We also have group managed areas so that we can produce a larger amount of food. Right now we're planting collard greens and turnips and mustards. We always grow what people here want to grow, and so up until the pandemic, we would have monthly community meetings for people who were involved or wanted to be involved. And they would tell us things that they do like, what they don't like, possible disputes between their garden neighbors. And they would tell us what to grow. And so, everything that's there has pretty much been built by the people who are experiencing homelessness. Um, and then we added on a horticulture program so that people um, could learn more about horticulture. And there's a couple of things that they can get from that program. It's really dependent on what their goals are. And so they tell us what they want from it. They can get a professional credential from it. Um, but some people just want to do it because it's therapeutic, and it helps them get through the day. Um, and some people want to just explore their options, or they just want to be able to put it on their resume later. A lot of people don't want to pursue the professional end of it until after they're housed, because it's just really hard to do that when you're in crisis. Or sometimes they decide to do that after the class is over because they didn't feel confident before. Um, where the curriculum that we created is really accessible to people um, with learning disabilities and other types of disabilities. We um, accommodate many different learning styles. It's very hands on, it's fun, uh, and we also accommodate low literacy because the average literacy level for people here is about eighth grade, and it's much lower for some people. And some people, their goals are completely outside of horticulture, like they just want to get their GED. And so we try to support them with those types of goals as well.
And how is it going with people growing? Because being outside in the sun, touching the soil is also therapeutic. And then for people to know that I'm putting something in the soil that I'm going to be able to go back and harvest and answer the need of my tummy.
People love it. It makes them so happy. And there's so many people here that grew up on farms, or they grew up watching their grandmother grow food, and it takes them back. There's people that had beautiful gardens and they became homeless and they don't have them anymore. And so, it gives them autonomy. Um, at the beginning of the pandemic, I got these big donations of plants because like Master Gardener had their sale that they had to cancel, and other places just like couldn't get rid of their plants. And so I brought these truckloads of plants and I just put them there. And I don't tell people what to do. If they want to learn something about like botany or horticulture, I'm happy to share. But it's theirs. And at the same time, there was an encampment being shut down by the city, and we built a campsite for 150 people.
Mm.
And so I sat all these plants in this area, and over a couple weeks' time, they all disappeared. And all these people who were experiencing homelessness, who lost their campsites, which were their homes, started planting across this like 25-acre facility. And I didn't
Wow.
anybody what to do. They were just all doing it on their own. And that tells me that if you give people resources, it, it's not about fixing people. So, sometimes people think that to solve these types of problems, we have to have this like punitive approach, and we have to control their behavior, and we have to be smart about what we do, and we have to have boundaries. But like, we don't. These people created something absolutely beautiful on their own, and all they needed was the plants.
Mm. Yeah. So Abigail, again, my guest tonight, Abigail. Say your last name. What is it?
Perrette Gentile.
Perrette Gentile. Abigail Perrette Gentile. Community outreach for the homeless facility here in Gainesville, Grace Marketplace, as well as the founder of Grace Grows, a nonprofit that is incorporating the love of growing, the love of producing food. And these people are gaining skills. They may be able to even start growing in another space where they can start selling what they grow.
So when people get housed, a lot of times the people that I work with in the garden don't want to leave their garden. I'm like, we will build you a new garden.
Oh,
And so,
where they move to, you will build them a garden?
yeah. So,
Oh, nice.
some people go into apartments, but we still set them up with whatever they want and whatever we can offer. Um, and one of my favorite people that I knew for a long time out there, he moved into this like little tiny house off of Southeast 15th, and it had a yard. And he waited to get housing until he could have a yard so that he could grow his own food. And so we went over there and we set him up with a garden, and he calls me up when he has a problem with his garden, or there's some sort of worm on his tomatoes, or at the transition of a season when he needs to be able to plant some more. And so I'll go over there and I'll take a look at it and tell him what to do. And he's feeding his neighbors.
Really? That's amazing. So, Abigail, how can people get involved? Everybody is being told to not go out, um, to socially distance, to not visit your loved ones for the holidays. How can people get involved? They can send money.
Yeah.
I mean, answer
So
your question. But yeah.
yeah. So you can donate to help us get by during this period. It's an incredible strain on our resources, and for Grace Grows being a really young nonprofit, it's all volunteer run. So you can imagine um, that it's a challenge, and we would like to grow as an organization, um, but it's hard when you can't really meet with people. I'm able to be here because I'm staff also at Grace Marketplace. Um, but we also have to be particularly careful because of the fact that the people we work with are more vulnerable. And it really, I hate to turn people away who want to come help in person, but there's other ways to help.
So how concerned are you about your health, Abigail?
I get tested every 2 weeks. I've been coordinating with the Medical Reserve Corps for the testing that goes on here. So I am fortunate to have an open line to a doctor. um, I it does Yeah, it is something that you think about. It's something that you think about if you live with somebody else. What if you bring it home to them? You know,
Mhm.
and that's hard. But Grace Marketplace has been absolutely incredible in supporting the staff. Um, they really take to heart some of their ideals. Um, when it comes to respect and safety. It's not just for the people we serve, it's also for the staff. And so I'm just really grateful. Um, they were even getting us hotel rooms, staff, if we were sick, so that we wouldn't bring it home to our families.
Wow. Has anybody with Grace Marketplace tested positive?
No,
Praise God.
yeah.
How many cases have you seen um, since this pandemic started?
So we've had 2 cases on site that were people that weren't in quarantine. They were in the main dorms. One was in the vet dorm and one was in the regular dorm. And we tested everybody in the beds around them. We did our own contact tracing, and it hadn't spread. All the other cases have been people coming in who were in quarantine, and so catching it prevented the spread. Um, and so um, for a while, I was getting a couple cases a month from people that were going into quarantine. And I haven't had any for about a month. I think it's been about a month. And then when those people do test positive, they go to a hotel, and we bring them meals and we check on them. And it's for 10 days unless they wind up going to the hospital and having a severe case, because then you can have it for longer. Um, but people do test positive for much longer than 10 days. But the CDC um, says that if it's not a severe case, that you're no longer contagious after 10 days. So they come back here.
So they're only in the hotel room for 10 days.
Yeah.
Okay.
And at first it was, we had to figure out how to communicate with people and to tell them how that they were positive and what's going to happen. And people were really afraid because there's already so much stigma, you know, about like diseases. People think that homeless people are dirty and are diseased. And so, you would talk to people, and there were a couple of people where we had to tell them that they were positive, and they're like, "No, I'm not. I'm healthy." And it's because they were afraid. And so we had to find a way to really communicate with people and tell them that, it's okay, and we're going to take care of you, and you get a hotel room, which for some people is a prize.
Yeah. They were surprised that they were going to get a hotel
No, it's
room.
a prize for people. They're like, "Yeah, I get a hotel room."
Yeah, yeah, yeah. Right. I would imagine. I would imagine. As the numbers, and we're now in the cold and flu season and the COVID pandemic. What's your greatest concern with the homeless population that you're working with?
My greatest concern is that the possibility of an outbreak and the complications of having like regular flu outbreaks, because every year um, there are really bad flu outbreaks here, and there's a lot of people that get pneumonia, and having a hard time being able to sort that out, when so many people are getting sick. How do you quarantine all those people? Um, how do you quarantine that many people? Um,
Yeah.
and the complications that could lead to a possible outbreak. Um, just losing one person is the absolute worst thing that can happen.
What are you hearing from other homeless shelters across the country? I know you said there was one where there was like 70 some people who tested positive.
Yeah, there was one where there were about 300 people. Um, and so I've talked to health departments and shelters and places that had really good plans. And what they did is they separated out the vulnerable people, but they actually also set up like hospitals that were run by medical professionals for homeless people. Um, and we don't have that here. We don't have medical professionals that are dealing. We have a doctor that's testing people, and I can call him. But as far as people testing positive for COVID and going to a hotel, we don't have medical professionals overseeing them. Um, and in the case of an outbreak, maybe we could get more assistance. Um, but in places where it's gotten really bad, it's just happened so quickly. It's hard to get a response in place unless you are ready for it. And that's one of the pieces of advice that other shelters gave me was be ready now. Um,
Are you ready now?
for as much as we can do on our end, yes, but we need collaboration with our health department and medical professionals. It would be really nice if we had a contingency plan from the from people who are emergency managers and public health officials, rather than I'm not qualified to do that. And I don't think anyone here is. So it would be nice if we had professionals um, doing that as well.
Well, what are you going to do?
So for things like this, and for other things that we've needed over time, it takes a lot of advocacy, and sometimes the advocacy, we have our city commission is pretty supportive, but we also need advocacy with different institutions within our local government as well, and so I don't have a good answer.
Are you hearing that from other agencies that are working with the homeless population across the country? Are we about to drop the ball on this?
Well, some places have done a really good job. My number one example is King County, Washington State. They did a fantastic job, and their epidemiologist estimated, I think, about 50% of the population there of people experiencing homelessness could get it. And with the medical vulnerability of them, the amount of people that could die would just be so big, but they had a really impressive response. And that was a coordinated effort between many different institutions. And so, what we really need is these institutions to come together and work together. Um, but it depends on where you live and the kinds of relationships that those institutions have to begin with, or their willingness to do that. And unfortunately, some institutions don't have a lot of willingness to do that.
The challenge also is as our healthcare providers are being overwhelmed by the general population. And I can only imagine how this adds another layer. But as you said, if you don't have any plan in place, if you had an outbreak right now, there is no plan in place to address a COVID outbreak. with homeless people in Alachua County?
I have a set of recommendations based on what other people have done successfully on um, what could be done. So, we have a plan. We just need cooperation from the institutions that can help us to implement that plan.
So you have one on paper.
Yeah.
Okay. Okay.
That's
Fair
not
enough.
sufficient, I know.
Fair enough. But hopefully, someone from some of these organizations that can supply the additional support services that are needed to take care of this very vulnerable population. And, you know, as they move about, they can continue to spread. And if we don't have something in place to help contain that, it just makes the larger population even more vulnerable.
Hmm.
Abigail, you are doing God's work. Thank you for standing in the gap for so many. I thank you for your time today to talk about the homeless population. And your story is probably not unlike many of the stories across the country, as communities have not been fully prepared to handle the increased number of COVID-19 cases that we're seeing across the country just for the general population. And so, if we're not prepared to handle the COVID outbreak for the general population, it has to be pretty dismal in most communities when it comes to our homeless population, with the additional challenges of disability, with our veteran population, with African Americans, with additional uh, challenges, as well as those who are dealing with mental health issues. A huge job you have before you, Abigail. We will be praying for God's covering for you and the team there at Grace Marketplace, as well as people who are working with the homeless population in other communities across the country. Any final thoughts on how you would like people to get involved?
People are welcome to reach out. As far as Grace Grows is concerned, we could use professional services as well. And we could certainly use donations so we can keep our programs going for the people out here. And as you go about your day and you do see people who are experiencing homelessness, look them in the eyes and treat them like you would your neighbor.
Mm, great advice. Abigail Perrette Gentile, she is community outreach for Grace Marketplace here in Gainesville and Alachua County, and the founder of Grace Grows, a program where she's helping people address not just their homelessness, but a therapeutic way to help get them back on their feet and address food insecurities, housing insecurity, and food insecurity. So, Abigail, thank you for the work that you're doing, and thank you for joining us tonight.
You're welcome. It was my pleasure.
And I thank all of you for watching, whether you're watching Facebook Live or you're watching on YouTube or listening on our podcast. Please, please be aware of those in your communities who need help. Thank you, Dr. Flora Claybrook, for watching. Thank you, my dear friend Kathy Mercer, for watching. Please share this video. Please encourage your faith-based families to seek out the agencies in the community that are addressing the needs of the homeless. I think people also, Abigail, before we say bye, I saw a statistic that said the average age of a homeless person is like 8 or 9 years old. There are a lot of homeless children that some of the other agencies are having to work with, and families that get evicted repeatedly get evicted. And we think of adults being homeless, but there are a lot of children. Gainesville Family Promise, I think,
Yeah,
houses families.
amazing organization. And there's a lot of invisible homelessness. You know, you see the people on the streets in downtown, but there's a lot of families that you don't see.
Right, right. I was told that there are people who are living in the woods here, so and trying to protect their children. Um, so please be aware of that. Do all that you can, and as you say your prayers tonight, offer up a prayer for Abigail and all of the people who are working with this very vulnerable population across this community as well as across our country. You all be safe, wear your mask, protect you, protect those that you are around, and let's continue to pray for the leadership of our communities and the leadership of our country. Again, Abigail, thank you very much. And I thank you all so much for joining us for this episode of Sisters of Wellness, where we are aspiring to share information and knowledge that will help you live a whole, wholesome, powerful, and harmonious life. I'm Pamela Marshall at the Wellness Radio TV and at the Wellness Radio TV podcast. Remember, there is healing at the well. Make it a great moment.